Sometimes we look at medicine and the symptoms, and the goal is to remove all of the symptoms. And if we can get rid of those, then we've healed something. And sometimes that's true, but usually it means that the body has done its own healing process while we controlled the symptoms, and something really has changed. If we just suppress symptoms and nothing else changes, then sometimes we really have to think, has this been a healing process?
So in many countries, when I went to India, for example, where they have Ayurvedic medicine, homeopathic medicine, conventional Western medicine, I asked them why were they interested in anthroposophic medicine? Because they have all this, and they have a whole spirituality, spiritual practices, yoga. And their answer, which I found very interesting, is that in India, they experienced all these as little fragments, as little self-contained approaches, whereas they felt anthroposophic medicine offers a way of integrating them all, bringing them together, rather than almost having a multiplicity of things.
Modern medicine need also to develop a concept to understand the real physical, emotional, spiritual needs of the patient, because this all affects the path of healing.
What we try to develop in the last 100 years in anthroposophic medicine, of bringing together different levels of the human beings, different levels of healing and medicine, may be that what we tried to develop in anthroposophic medicine can be of help if now in the bigger field of integrative medicine the question arises how to combine these different approaches in a meaningful way.
If we understand that an organism has self-healing resources, then it must be possible to have a clear handling or communication with these resources, because a pharmacon you can see also as a communication tool. And I think this needs to become and will become a major area of pharmacology, that you use substances specifically to stimulate self-healing resources.
The World Health Organization, WHO, published benchmarks for training in anthroposophic medicine. And WHO did this because they see that anthroposophic medicine is one of the important complete systems in traditional complementary medicine, like traditional Chinese medicine, Ayurveda, and so anthroposophic medicine is one of those systems.
Direct our gaze towards and through.
I think everybody who has got any kind of common sense is very well aware, and nowadays more than ever before, that what impacts on our senses and mind and consciousness is going to have effects on our body. That's, even the most materialistic medicine is now speaking that language.